just to set the scene, Avi, it's Wednesday the 25th. Clearly the novel coronavirus, at least the COVID-19 disease, is engulfing the Western world. Feels like we're drifting into the eye of the storm over the next 2 or 3 weeks, slowly. I have to admit, I've stopped watching the news since the weekend, just because it's not doing me any favours. So I'm just focusing on what I can control and staying healthy.
Right, yeah.
I am getting bits sent to me, a few articles, a few text messages. Some of my friends are extremely anxious and some are sanguine and very positive. So yeah, I'm trying to shield myself as much as I can. But I was interested to talk to you today, firstly, about your community work. So I know you've been saying you're doing some good work in the community and how you're supporting the most vulnerable and what you've learned so far from that. And then secondly, as a business and data leader, how you're thinking about this from that perspective and how businesses should be responding and thinking about this, especially sort of data units and data teams. So where's the opportunity in this and how can they deliver more value in extremely difficult, changing circumstances? So let's start with community work, Avi. Let's see what you've been doing.
Yeah, thanks. And so thanks, Steve. Yeah, I think I share with you that sort of mixture of, a degree of anxiety about what's happening around us, caring for those closest to us. And equally, I am holding on to quite a degree of optimism as, we see things around us changing, in many cases for the better. So I'm actually really pleased you've asked me about that question about sort of community engagement.
Yeah.
And I wanted to just sort of talk about it from two perspectives. One is completely anecdotal, there's just something I've observed, and the other is one I've participated in. So the anecdotal one is the macro level. It's actually the action the NHS has recently taken around creating the list of the 1.5 million shielded people, those who need to very proactively isolate themselves from the rest of the community in order to keep themselves safe because they have particular vulnerabilities. And listening to the experts, on TV, on radio, who talked about how the NHS has pulled that together, you heard that, data people have probably made a really, really sterling effort to do something that was quite difficult. They've pulled together data from hospital records, from GP practices, from various other sources of data that's not fully integrated. They'd have had to have collated it, correlated it, done all sorts of cross-referencing in order to produce that in a very, very short amount of time. The simple fact is there is no database that has your name on it and COVID risk, yes or no. There's no flag, which so many businesses love to rely on. Can you run me a query that sorts out, people who love knitting in Barnsley or whatever. So I was really quite impressed. And I think what also impressed me was the absolute transparency with which they brought that list to the public's attention. And they said, we've erred on the side of caution. We've probably caught some people who don't need to be in the list. But it's better to include somebody who doesn't need to be in there than miss out somebody who does. And I thought that was really good to hear sort of practical approach to a real world problem from data people to help all of us. And and I think that's a good lesson in these times, particularly, that sometimes good enough is good enough. So that was that. And the second thing I want to talk about is a much more micro level. So as many of us, I've got involved with my local community in trying to establish networks for mutual aid, because it's clear to us that members, neighbours, friends, people perhaps in faith communities or whatever, are going to find themselves in a degree of difficulty. They may have an entire family having to self-isolate, perhaps their neighbours are at the same time. They need to get access to shopping or to medicines or whatever, and it proves to be very difficult. So, there's a lot of these springing up around the country. And I've been involved in one in particular. And when we first started, we thought about using a software system to do it. And essentially to broker between people who need help and people who are willing to give help.
Yep.
And there's software out there to do this. But what we've thought about very rapidly, and actually it was in conversations with people who were going to be consumers of this service and providers of this service. So there was a real bit of gathering requirements from the users. People said, no, we've got to go really super low tech here. Our vulnerable, if we're going to use that term, people, and that could be anybody of any age or whatever, may well include a higher percentage of older people who are not as tech savvy as we might want them to be, or we might need them to be. And also, it might not be the moment when somebody's in distress for them to start learning how to use new tools.
Yeah. So something like Slack's going to be very difficult to roll out.
So anything that's unfamiliar when you're already in a distress situation just can add to that. So we thought about it and we said, well, what do most people know how to use? And it was the telephone and email. Mm-hmm. So on the, shall we say, the demand side of the equation, we said people needing help, they just need to contact us through a telephone number, and I wrote a protocol of what information needs to be captured from these people, or through a simple email, again, with a protocol and some guidance. And then we simply put it into a very, very simple database, and we communicate to our volunteers using WhatsApp.
Okay,
And we created a volunteer community using WhatsApp, and we effectively have a small team of coordinators brokering, doing the integration piece. We don't have time. We didn't build a software solution. Unfortunately, at the moment, we've got loads of people sitting at home doing nothing. But there's people who've got some time on their hands, and it's up and running. And from concept to running took us 2 days. We've already helped a number of people who have been in quite dire need of help. An elderly couple where both of them, one is ill and one is forbidden to leave the home. So one is having to self-isolate, one is being shielded, who needed medication. And we were able to get that to them, really quickly. And what we also did in doing this was, and why I think my involvement as a data professional was so important, is that I was also thinking about all of the good things that we have to do in data programs. I was thinking about data security. I was thinking about the privacy of the people who are using the service. I was thinking about the protection of that data after it's been used, and what gets done with it. So we built some protocols around data governance, around GDPR, and various other things, and have got everybody, signed up to that, and we're managing that in the best way. So we've put controls around this. We've not done it in a way that puts anybody at risk. And when you think about it, somebody could be sharing there some incredibly personal information about their individual circumstances, which, they may not want many people to know. So that for me was, a great lesson in how a data professional can contribute in their community, in helping us make lives better today. So that was...
It reminds me, Avi, of something I've heard you say a few times at conferences you spoke at for us about. So someone sitting next to you and passing data across to them, that's a data pipeline. There's no difference from, technology data pipelines. So that's really interesting. What is the situation in frontline? What are vulnerable people saying? How scared are they? Are they all very scared? Are they all very...
So again, this is very anecdotal from what I'm seeing. So some people are very scared. They're frightened. And we collectively have a responsibility to hold them. And to try to help them feel safe. And it's great to see that the government is now stepping in with its NHS volunteer setup, which is very, very similar to those community and local organizations, looking for 250,000 people to help. But then there's also the other side, that people feel greatly comforted in a time when we're being driven apart by social distancing, that we're then able to establish, using technologies, networks that actually increase interconnectivity and touch. You can't hold somebody, you can't, sit down and have a cup of tea with them. You can do it virtually. And, some of the things we're actually doing and seeing is that people are having virtual tea parties, which is just lovely. And again, that's about brokering, making sure you're using technology to build those networks. And again, having professionals, IT and data professionals involved in that, make sure that that's done safely and securely, because all of us need to also be deeply aware that even in a national crisis, there are some people who will exploit people's need.
Absolutely.
So
you touched on it there, but what is the risk of carriers bringing it to their door? There's one thing that's going through my mind is how safe can it be? What precautions are you taking to make sure that doesn't happen?
Okay, so I'm not an expert in this. So what we did there was we reached out to people who are they're professionally involved in social care.
Okay, good, yeah.
And we are, excuse me, and we asked for their guidelines. And taking those guidelines along with the government guidelines, which are pretty clear. Yeah. We've given very clear, excuse me, very clear instruction to our volunteers as to how they need to behave, what hygiene precautions they need to take while out shopping, and how they deliver, which is a complete no contact delivery service. So again, I think what we've been able to do really quite effectively is pull together, and it's in many ways it's a shame that we can't get IT projects to work like this. Pull together a multidisciplinary team, each one of those bringing into it their particular expertise, contributing to both the requirements set and to the solution that gets delivered. And equally, we've got a level of collaboration that is allowing us also to learn and correct, which is an essential part of any program and in data programs as well. That as we see things that are not working as well as they might, we're taking that away and then improving. So we've got very positive feedback loop happening. So it really is quite extraordinary.
Can you give me an example of an iteration? How have you tweaked it or changed it?
Yeah. So one of the ways we do this is when I'm going to call it a job. When a job comes in, we do not publish to the entire group all of the details of the job, because that would reveal too much personal information. We only give the first 3 digits of the postcode and say, is somebody able to address this request in this locality? With the government now tightening the rules, we've recognized that actually people traveling across postcodes isn't a good thing. So I don't want somebody from the north of the region traveling to the south of the region. We try to want to keep things localized. So we've now started collecting postcode data from our volunteers, which means that when necessary, we can do targeting messaging. But what we're also thinking about is, should the demand increase to a large extent, we may well create groups that are more specific for smaller geographical areas, perhaps 5 or 6 neighboring postcodes or whatever, if we find that the larger group just becomes too unwieldy. So, that's an example of thinking that's coming into it. We've enhanced the data. We're thinking about the next stage. We're trying to think about what we need to do to future-proof this should demand increase. And what we also do is the coordinating team, we debrief constantly. So we feed back experience and say, I've just seen this. And for instance, one of the newer ones is recognizing that there are certain places where going shopping is not a pleasant activity because that particular supermarket might be under a degree of pressure or whatever. So again, we can sort of start thinking about targeting information to people. What we're being particularly careful about is not creating an information overload. So you'll be a user of WhatsApp groups, and once the chatter starts, people start to mute or disconnect or ignore. So again, one of the learnings has been we are being very strict, and I have to say ruthlessly strict. If anybody posts anything, even with the best of intentions, that is informative or whatever, they're politely asked to remove the posting, and then a private conversation is had with them to say, please don't do that again. All that we want on this channel is request in and somebody prepared to take it.
Okay. And is it all staying in WhatsApp? You're not putting it out anywhere else? It's still staying in WhatsApp?
No, we're doing it all in WhatsApp. And what we do is we're using as our publicity channels, if we're going to use that terminology, other social media networks that are already established with that community. So for instance, Facebook groups, and various other things. But we are moderating registration, that if somebody wishes to volunteer, they go through vetting. In other words, somebody on the coordinator group has to know them personally and vouch for them that they're bona fides and it's safe to bring them into the group.
Yeah. And roughly numbers, Avi, how big's the volunteer group, roughly?
So we're holding at the moment at this particular group at 40. I've got more in reserve, a lot more in reserve. And we are seeing that. Huh?
Sound like the Bank of England.
Yeah, well, yeah. It's lovely. I mean, it really is. It's, I've got to say, it's heartwarming to see the level of willingness. But with the reason we have that larger number and the reserve is, one, to give us the geographical coverage. It means we're ready to scale up should we need to.
Yeah.
But also we're acutely aware that people will from time to time fall ill or have to deal with their own family circumstances. So people will drop out. And we've been incredibly supportive of people who've said, I thought I could do this, actually no. We've basically given them a virtual hug and said, look, really value your contribution, take care of whatever you need to take care. Should you be interested in coming back, let us know.
Yeah, great.
So on the one hand, it's really quite disciplined and very firm and quite instrumental in the way that we're working, but equally we're recognizing that there's a degree of softness that has to be brought into that, and it's that combination of the two that I think we're getting right at the moment.
Yeah, and hopefully that's a long-term takeaway for hopefully the world, isn't it? Just more compassion and empathy for everything out of this, hopefully.
Yeah, lovely. And we've got another initiative which we won't go into huge detail about, but very similar now, is about creating an online IT help group, particularly for the less IT savvy, that won't involve going into their homes. Now, this will be created through a volunteer network, but just think of the possibility of that, as we move out of this COVID era and into the world of thinking about how you can offer, real practical support to people without having to come to their homes.
Yeah.
So,
brilliant.
Yeah.
Great.